Good morning. This is your daily dose of complete health. And as you can probably still hear, my voice isn't necessarily doing that much better today. I feel like I've got a really, really deep voice. It's actually quite interesting. But I just wanted to jump back on and talk about why chiropractors look at the spine so much. So what is the purpose of our spine? What does it do? Why do we make adjustments to the spine? And how does that really help our patients to get better? Well, when we actually look at the spine and the brain and the spinal column and the spinal cord, what we have to understand is that our spine's primary function, our sole primary function of our spine, is to protect our spinal cord and our brain. So we look at the skull and the spinal column is protecting our brain and our spinal cord. Well, why would we have a specific set of bones for protecting just this system? But in the same sense that we have bones to protect our lungs, in the same sense we have bones to protect our lungs, well, we need bones to protect our spinal cord and our brain, because if this system was damaged, we couldn't really survive without it. So like our heart and our lungs, if they stopped working and we stopped breathing, we would pretty soon stop functioning. Why? Well, when we lose oxygen, we can't get oxygen to the brain or our muscles, and so our system starts to shut down. In the same sense that if we lose function of our brain, we can no longer control the function of our organs, including our lungs and our heart. So if there's any way that you could have damaged your brain and your nerve system, that you will genuinely see a change in health or function or expression, whether that's a change in muscle function, whether that's a change in sensory function, or whether that's a change in organ or autonomic function. Now, I do a full hour class on this because I believe it's one of the most interesting concepts that you can see within the health space. Because if we can keep a healthy brain and nervous system functioning, then all of a sudden we can start to see someone that can much better express their health. So like I say, what do the adjustments do? Well, the adjustments allow for the spine to move correctly or takes pressure off of our brain and our nerve system so that those messages can start to function better. Now, if those messages are not working properly and they can start to change the way that we express our health, or we start to move improperly, then we can start to see changes in the way that people's muscle system starts to work, their sensory system starts to work, and then the way that their autonomic nervous system can start to work. And there are specific conditions that, if you look them up medically, are exactly the description of what is going on when we talk about this. So we've got stuff like Aquino Syndrome, where we put pressure on our nerves and our low back. It starts to cause issues with sensors into the leg, pain into the legs, or changes in actual muscle strength into the legs, as well as potentially some organ dysfunction, e.g. bowel and bladder dysfunction. And we can see stuff like radicular pains down the arms, so trapping a nerve in your neck where you can start to get sensory changes in your arms. But when we start looking at the nerves around the neck and the shoulders, they're actually really controlling stuff around the upper heart of our chest cavity, so stuff like our heart and our lungs. So there has been links to certain areas of the spine and their function as far as organ function is concerned. So if your spine isn't working properly, how can you indefinitely say that you are not actually starting to cause damage to one of these systems, consciously or subconsciously? Just some food for thought. This is why chiropractors are so keen on the spine, because it's pretty much the system that controls everything. So if we can adjust that spine and keep those things working properly and make sure that someone's health is expressed at full potential, then that person can start to actually manage and heal themselves, which is pretty freaking cool. So if ever you've ever wondered what an adjustment looks like, jump onto our YouTube channel, or just jump onto YouTube. You'll be able to find a million chiropractors adjusting anything from a very soft touch to a firmer pressure. Depending on the patient and the amount of force that that body can handle, a chiropractor will have to adapt their level of force to that person. Because if someone's got fibromyalgia, you cannot physically adjust them in the same way that you would do if you were a 14 stone, 15 stone, 16 stone, 18 stone rugby player. You would have to adapt those changes differently. Patrick here from Complete Health. This is your daily dose. Hopefully my voice will be back. in the next few days. But it's been nice to speak to you anyway. Take care for now.